Welcome to Picture of Health. I'm your host, Lauren Lengyel. Today we have the pleasure of being at Watson Clinic's Sleep Disorders Center with Dr. Shahrour. Did I say that right?
Yeah.
Okay. And he has been kind enough to talk with us, so thank you so much for your time, doctor.
Thank you, Lauren. Thank you for coming.
So tell me how you got into, obviously I've been getting an education on pulmonology and who all can be qualified as a sleep disorders physician, but how did you get into sleep studies?
Well, I mean, to be really a sleep physician, you have to go through the whole thing. You know, after you finish medical school, you have to do, your residency, typically internal medicine, and then you have to do one of the subspecialties. So I did pulmonary, and usually the sleep disorders are related a lot to respiratory issues, so it is actually part of the subspecialties, so you can get extra training for that. During training in pulmonary, you see a lot of sleep problems, so that's how you actually develop the interest into it, and it is very common, and a lot of people actually need help. That's why I intended to actually do it after I finished, and that's where we are now.
And you were saying that it's not just specific to pulmonology, that it could be an ENT doctor or?
Yes. Well, most sleep physicians are pulmonologists, but other physicians who are interested could also go into the field, typically neurologists or ENT doctors. The ENT doctors, the ear, nose, and throat doctors, also deal with mostly sleep apnea. That's why some of them actually are interested in going into that field to help patients with sleep apnea.
So, obviously sleep is something that is very dear to my heart, but from a medical standpoint, why is sleep so important?
Sleep is like a resting, phase. It's like a resting area for, like a long trip. It is actually part of the human nature. So without sleep, none of the systems in the body actually function very well. So sleep regain the energy to the body. It actually gives everything the energy and the refreshment they need to function well the following day. Without sleep, blood pressure will dysregulate, even the chemicals in the body, even the brain, the heart, the muscles, the nerves, they all need rest to actually function well the following day. And typically you can see patients saying, I'm refreshed, I'm ready to go, I'm not ready to go. When they're not ready to go, the chemicals in the body are not really in the right, amount and position and structure.
So typically, how many, and obviously this is just a generalization because everyone is a little bit different, but what is the general number of hours of sleep that a person should have, an adult should have?
Okay, for adults we're talking about 6 to 8 hours, on average, but people could need as little as 5 hours, but some might need like 9 hours or so, but most people actually need like 7 hours plus minus 2 hours. Now, if we're talking about teenagers, that's different. They might need 9 or 10 hours. The kids needs more.
Right.
When the kids, when the newborn, for example, needs like 23 hours of sleep, and this goes down as the newborn, as the kids actually grow up until they reach the adult life. And typically this is 6 to 8 hours in general.
So if someone's not getting that restful sleep, because when you say 6 to 8 hours, you're talking about restful sleep, correct?
Right.
So if they're not getting that, what are some of the things you start to look at?
Okay, so we're talking about the duration of sleep, but actually what matters is the quality of sleep, and the way we measure that is how the person feels when he wakes up in the morning. If the person feels good, refreshed, ready to go, that's really what he needs. That's it. Whether this is 5 hours, 6 hours, 8 hours, or even 9 hours. But if they don't feel good in the morning, that means either the duration of sleep is not adequate, they need more sleep, or a lot of time the quality of sleep is not good. So that means either the sleep is interrupted or the person is not actually sleeping in a deep phase as expected. We have to go through stages in sleep, and we have to reach all the deep stages, and especially REM sleep, stage 3 now, we call it N3, to really have good restful night. Otherwise, the muscles would be tight, the nerves would not really be in a comfortable position to get refreshed.
So, as someone is, feeling exhausted and their quality of sleep, they can tell is not very good. And they wake up, they're not ready to go, and it's happening over and over again. And they say, "Hey, maybe something's going on.
Right.
I need to seek a physician."
Right.
Tell me. Actually, let me back up for a second. So, here at the center, what are some of the things that you see? What are some of the disorders that you all see?
So the most common sleep disorders that we see here is number 1, insomnia, inability to sleep. And actually insomnia could be inability to initiate sleep. So people actually go to the bed, but they can't sleep right away. It takes them a long time to actually fall asleep eventually. Or they may not be able to maintain the sleep. So they kind of wake up too many times. And there might be reasons for that, medical reasons or psychiatric reasons or other reasons, like sleep-related reasons. Or they wake up too early and they can't go back to sleep. So any of those is considered insomnia. So having less hours, inability to actually maintain good and successful sleep is insomnia. What we see also is sleep apnea, one of the most common disorders. By the way, insomnia is very, very common. Almost 50% of people at one time of their life, they actually develop insomnia, for whatever reason, stress, change in environment, psychiatric issues, medications, medical illnesses, and so on. But eventually, 1 out of 10 of people actually maintain insomnia problems. So we're talking about 10% of the population, which is really a significant number. Then we see sleep apnea. Sleep apnea usually is related to snoring. Usually 25% of the population snore, worldwide, but only maybe 5% have sleep apnea. And it's usually more in men than women, like 4% maybe of men have sleep apnea, and maybe 2% of women have it. And typically what happens, they snore, they relax their muscles too much, especially the muscles around the throat, so they close and collapse these muscles and they block the airway. And that's sleep apnea. They can't sleep at night because they actually can't breathe. And sometimes they're aware of it, sometimes they're not. They could actually sleep through these episodes, and the oxygen usually goes down, and the sleep quality, that's where we talk about the sleep quality, may not be very good. The body becomes very, very stressed during these episodes.
And obviously, I have no medical credentials, but if you're not breathing, that's an even bigger problem than you're just not sleeping. Am I
Yes.
right on thinking
Oh,
that?
definitely. So actually, the medical research showed that for whatever reason, if you're not sleeping very well, if you're sleep deprived, okay, for whatever reason, if you sleep even too much, you have consequences. So, for example, in sleep apnea or even insomnia, the research have linked these problems to a lot of medical issues, and even to not only to quality of life, but also to the longevity of people. People actually die earlier if they don't sleep very well, or if they sleep actually longer. There's a lot of chemical reactions in the body, we call it inflammation, that actually happens. A lot of hormonal changes, like cortisol level usually goes high, the insulin goes high. Some of the hormones actually, if you don't sleep very well, also changes, like the ghrelin, the hormone that makes people actually feel hungry. They get more weight. If they don't sleep very well, they actually gain weight. So obesity was linked to this. There's another hormone called leptin. This is the hormone that tells the brain that that the body had enough food. And if there's a dysregulation in this hormone, actually people thinks they're hungry and they do not need the food, so they actually get extra food and they just gain weight with time. And this has consequences. They have high blood pressure, diabetes, even heart disease, even brain issues, strokes, and so on. These have been all linked to sleep disorders.
So this is the issue. You need to get the sleep. Your body needs this rest.
Right.
It needs to repair. Okay, so I now know why I've got a few extra pounds. So what are some tips that we can offer our viewers on how to get, I guess, better sleep?
Okay. So first, take it easy. You have to regulate your sleep. You have to be regular. And what I mean by regular, number one, you have to really wake up at the same time every night. You have to set the biologic clock in your brain right. If you give different signals to the brain at different days, then the brain get confused and then you can't sleep very well. So always set first, I mean, if you can't really wake up like naturally, you can set up the alarm, and you have to wake up at that time every single day. And then the body will regulate when to go to bed usually. So be regular, that's number one. Try not to drink too much coffee, especially in the afternoon, because it stimulates the brain. And even though you feel like you're addicted to coffee, it doesn't really affect your sleep. It does, in fact. You may not actually sleep at a very restful stage of sleep. You might sleep, but in different stages. Alcohol, although it's relaxing, a lot of people have this myth of having alcohol in the evening to actually make them relax. Alcohol has actually a rebound effect. After 2 or 3 hours, it kind of stimulates the brain and make people actually having hard time sleeping. Usually the sleep environment should be really good, less noise, less lights. The bed has to be, very comfortable and so on. People should actually treat their stress. If they have any other illnesses, they should treat them. Otherwise, the illness will interfere with the sleep, and then it becomes a chronic problem, even if the initial illness is resolved. So these are, some of the, minor tips that we tell patients to do.
So if someone's having issues and they've decided to seek a sleep physician, so what are some of the stages involved with that? Like, what's the first thing they need to do? Where do they go to find this doctor?
They need to call the sleep physicians. They can call our center. Definitely, we have 4 experienced sleep physicians here at the clinic. The first thing we do is we evaluate the patient, because some of these problems could be resolved even without doing a sleep study. We have restless leg syndrome, for example. It is one of the most common sleep disorders. We can diagnose that basically by talking to the patient. We can give medications for that. The sleep disorders could be related to other disorders in the body. We could discover that and actually direct the patient how to solve his problem. And then when we decide that the patient actually needs a sleep study, we typically it's very, very easy process. We refer the patient to the sleep center. The patient usually is called, and they set up the appointment for him. Now, the sleep center, we have 2 kind of sleep studies. One that we do at home, and one we do at the lab. The difference is the one we do at home is a partial sleep study, and it's not attended by a technician, but we teach the patient how to do it. The one in the lab is actually more sophisticated, more complete, and we have a technician that actually observe everything and monitor the patient from a different room. So what happens is the patient comes usually in the evening and they leave early morning. During the sleep study, we monitor too many things in the body to see what's going on. We monitor the brain function, the heart function, the breathing, the airflow. So we put something in the nose to see if the patient is actually breathing or not. We monitor snoring. We monitor the muscle functions, and we monitor even the movements of the chest and the abdomen to see if the patient actually stops breathing as well. We monitor the oxygen overnight as well. So there are like 20 things that we monitor, and the combination of these things will tell us whether the patient has problem in the brain, like seizures, or in the heart, or actually sleep apnea, where the muscles actually relax too much and the patient stops breathing, or even the legs and the muscles if the patient has restless leg, and so on. We can also monitor the patient for what we call REM-related behavioral sleep disorders. And the REM sleep, which is actually the deepest sleep, but the patient can actually see dreams in there. So we can't tell if the patient is actually seeing dreams. We can't tell what kind of dreams it is. So I can reassure everybody. But we can tell that the patient is actually in the REM. With the camera, we can tell that the patient is acting out their dreams. And this is one of the sleep disorders that we can actually see in the sleep lab, and we can't see it at home.
You're watching Picture of Health. We'll be right back.
Healthy living is important, both now and for many years down the road. What you do today will make a difference tomorrow. Meet Tom. He wants to live a long and healthy life, too. That means he must make healthy choices every day through each stage of his life. Right now, Tom is a young man in his mid-20s. He has just been discharged from the Air Force and is ready to start a career in commercial flying. Although he smokes cigarettes occasionally, Tom knows he needs to quit for good. That way, he can reduce his risk for many chronic diseases and cancers. He's in very good physical shape and wants to keep it that way. In his 30s, Tom starts jogging for 30 minutes a day and watches what he eats. For him, that means eating more fruits and vegetables and less cakes and cookies. He eats less saturated fats like butter and chooses healthier fats like olive oil. Although he enjoys a good burger every once in a while, he starts eating leaner meats like fish more often. As he starts his career as a commercial pilot, Tom notices rising stress levels. He talks to a member of his patient-aligned care team, or PAC. He recommends 5 minutes of meditation each day to help manage his mind and emotions. He also recommends to get 7 to 9 hours of sleep each night. Each of these life changes helps to set Tom on a course for good long-term health. Some years have passed, and Tom is now in his early 40s. He's still in relatively good health, but now struggles with a chronic sore back. After talking to his PAC team, he's referred to a physical therapist who recommends he try yoga. That helps him become more flexible and to lessen his pain. He also starts drinking more water. His primary care doctor encourages him to stay on top of his health screenings and reminds him that he's due for his first colonoscopy at age 50. In his late 50s, Tom is still an avid runner and has even completed a few marathons. That's important, since Tom wants to work harder at building lean muscle mass at this age. Bone loss will soon become an issue, too, so Tom makes sure he eats enough calcium-rich foods each day, such as low-fat dairy, spinach, and sardines. He goes to the gym 3 days a week to do strength training. That keeps his bones and muscles strong. Tom is in his mid-70s now and enjoying his retirement years. Though making lots of healthy choices and regularly seeing his doctor over the years, he has very few health complaints. He works with his primary care provider to control his blood pressure with diet and medication. He is still active, but has noticed some pain in his knee from years of running, so now he takes 30-minute walks around his neighborhood each day and plays the occasional round of golf. That, along with a healthy diet, helps him avoid osteoporosis and other bone health issues. Tom makes it a priority to see friends and family regularly. He spends his days at the local senior center, where he's the reigning chess champion. Not only does that make Tom happy, it keeps his mind and memory sharp. By living a healthy lifestyle, staying on top of screenings and vaccinations, and staying connected to family and friends, Tom likely has many years of health and happiness ahead of him. Just like Tom, you too can live a long and healthy life by making the right choices every day. Talk to your PAC or primary care provider about what you can do to improve your health now and throughout your lifetime.
Welcome back to Picture of Health. I'm here with Dr. Shahrour, talking sleep. We were just about to get into some more information about the effects of untreated sleep disorders.
So actually, as I said earlier, the sleep is part of the health. So not having a good sleep, it will dysregulate the whole human body. Not sleeping well actually creates a lot of chain reactions in the body, and this has been shown in actually many studies. Some of the studies were actually experimental, where actually people were taken into the lab and they were sleep deprived, and we can tell that the body actually reacts badly. Like, for example, people who have high blood pressure, they will have harder time controlling their blood pressure the following day, and this has been shown. Patients who do not sleep very well, they lose a lot of their reaction, normal reaction. Their reflexes become very slow. That's why people who do not sleep very well or have sleep disorders actually get into more motor vehicle accidents. So that's why the Department of Transportation actually asks people if they have sleep issues to actually get checked. So the inflammation that happens in the body and the hormonal changes in the body will actually increase the blood pressure. It will dysregulate the glucose. A lot of hormones will change, and then people might have cardiac issues like cardiac arrhythmias. They have too fast heart rate or dysregulated heart rate, and typically something called atrial fibrillation, or sometimes at night, if it is really severe, the heart could go very, very slow. And it's been reported that actually people could have sudden death if they have severe sleep issues, especially with sleep apnea, where the oxygen actually can go down very low, right? So the following day, the patient can tell. I mean, they're not thinking very well, and if this continues to be on and on, actually there is a cognitive issues. Mm-hmm. So people actually lose part of their memory. Long term, they cannot think very well, they cannot, their logic becomes a problem, and so on. And they could have actually heart attacks with time. So that's why we stress if you have any issues, you should really address it early so you can prevent further problems later down the road.
Absolutely. Are there differences in men and women when it comes to sleep disorders? Are some women more prone or men more prone to certain things?
Yes. Well, sleep disorders actually affect men and women. There might be slight differences. Usually, women actually sleep a little bit better. That's what the research showed. They sleep a little bit deeper, longer. The sleep efficiency is better. However, with the hormonal changes in the woman body, especially after the menstrual period, puberty, and then the menopause, they tend to have more problems. Mm-hmm. However, we know that certain sleep disorders actually happen more in men, like obstructive sleep apnea, like the REM sleep behavioral disorders, acting out dreams and so on. Usually it happens more in men. And sometimes it is related to some neurologic issues such as Parkinson and so on, but it doesn't have to be. Certain sleep disorders might be more common, slightly more common in women, such as like restless leg syndrome, where actually women can feel something strange in her legs, especially in the evening when they go to bed, like either twitching, jerking, even burning sensation, or tingling and stuff like that. And usually people like to move their legs to make them comfortable, and they toss and turn a lot in bed before they go to sleep. And sometimes they actually wake themselves up in moving their legs, and their partners in bed can sometimes tell that they get some kicks, so they can testify to that.
Right.
Yeah. So in general, women and men are affected by all the sleep disorders with some variations with time. And definitely, as we get older, we get more problems. And the reason for that is not really the age itself. There is a myth that older people actually tends to sleep less, or their sleep has to be abnormal. No, the sleep in older people should be the same. However, because of the other medical illnesses, medications, and so on, that usually affects the sleep. But they should have almost the same sleep pattern as others.
So I know that we mentioned a few different types of disorders, but in sleep apnea specifically, what can you do to treat that?
Okay, so sleep apnea basically is a very complex disease. There is a weakness in the respiratory sleep center in the brain, so it does not actually produce enough electrical impulse to keep these muscles open during sleep. So what happens is these muscles around the airway, especially the upper airway, collapse. So typically it is mechanical issue, and of course it's a neurologic issue. We can't usually treat the sleep in the sleep or respiratory center in the brain. So what we do, we keep the airway open. The most common treatment for that is to use a CPAP, which is a device that creates a little positive pressure in the airway, especially in the upper airway in the throat. And this is usually done by a little machine that generates air and connected to a tube and a little mask. The mask could be in the nose or on the nose or on the nose and the mouth. We call it full face mask. The air goes through and the air creates positive pressure, so it pushes all the muscles to the side and the patient can actually breathe well. We adjust the pressure in the lab to make sure that the pressure is right. We have also an automatic machine that senses this phenomena and actually creates pressure to spread the muscles apart, and the patient can actually sleep very well with that. However, we have also other modalities of treatment. If in very mild cases, we could do some surgeries. However, I have to caution people, only maybe 10-15% of patients, even with mild to moderate sleep apnea, could benefit completely from this. They will get better, but it's not curable most of the time. There is another modality, and that is what we call the mouth appliances. Sometimes we send them to an orthodontic who can actually create a mouth appliance for them to advance the jaw, so the throat becomes a little bit wider. It has to be mild cases. And recently there is a device called Inspire. It's actually like a pacemaker. Usually it's implanted under the skin, and there's a wire that goes to the base of the tongue. In the evening, the patient can activate the device, and actually the muscles will retract, and there will be more space for the patient to breathe. There is strict criteria who could go for this device as well. And usually we make the decision if the patient actually can or cannot benefit from that device after we see the patient.
Now, I have a very human question. I know that there are some people in my life that suffer from sleep apnea, and they have the face mask. And they feel a little bit vain. And it's not a big, very exciting thing for them to wear that. But you sort of answered my next question about how there are other things that can be done if they meet that criteria.
Right. So actually the device is tolerated by at least 80% of people. Yes, some people will have a problem with either the pressure or the mask itself. And a lot of time it is just a matter of talking to the patient and finding out what the problem is. If the patient loses contact with their physicians or the sleep technicians, they suffer, without telling anybody. And they just feel like this is the way it should be. No, the mask should be actually comfortable. Sometimes it is the right mask. It is, whether it is like in the nose, on the nose, over the face. We even have masks that covers the whole face. And sometimes, it could be just adjustment. The size of the mask could be wrong. So patients sometimes have too much pressure when they put the strap on, or sometimes they have leak, and the leak can wake them up. So actually bringing the patient to the lab, and we have actually a very experienced technician who talk to the patient about these particular issues. Most of the time, it is resolved in the lab. But if the patient cannot tolerate the mask whatsoever, or if they refuse to wear the mask, yes, we have alternatives.
So where can our viewers go to get more information about sleep studies and sleep disorders and things like that?
Okay. Well, they can go to our website, the Watson Clinic website, the Sleep Disorder Center, and they can find a lot of information. However, they can find it also on many websites, even the NIH, the National Institute of Health, the Sleep Association, the National Sleep Association, and National Sleep Foundation. They can also find a lot of information on the sleep study and sleep disorders.
Well, I'm afraid that's all the time we have, but I really appreciate your time, Dr. Shahrour.
Sure, my pleasure.
Thank you so much.
Thank you. All right, thank you.
Thank you for watching Picture of Health. You can catch reruns on PGTV. I'm your host, Lauren Lengyel. We'll see you next time.